Hello, this is Dr. Morga. Again, I am an anesthesiologist and I am hereby giving you many lectures on Hillman Talk University, Journey Through the Perioperative Phases. And here I will be talking about PACU and discharge. All patients who go through general anesthesia must go through the post-anesthesia care unit, shortened for PACU. Your anesthesiologist and your nurse will bring you from the operating room and they will give report to the nurse who will be in charge of you in PACU. You'll be hooked back onto monitors. You may be given supplemental oxygen via a face mask, which sits like this over your face, or nasal cannula, which are little plastic prongs that go in your nose connected to oxygen. They will be monitoring your vitals, your hemodynamics, your oxygenation level, your blood pressure, your fluid status. The nurses in PACU will make sure that they take a good look at any of your incisions, what type of dressing there are, and if there's any shadow of bleeding behind the dressing, they'll make a mark on it. If there are any drains, they'll make sure they pour out the drain or mark how much is coming out of the drain. The PACU is a very important area. In the PACU, your level of care is considered similar to that you receive within the operating room and to that in the ICU and to that in the ED. PACU nurses will be treating you for any acute pain symptoms. Usually at this phase, we give you IV medications if you have an IV, and depending on the severity of pain. You are probably still confused. Some people are still coming to. And there are many different reactions that may be viewed as you transition through anesthetic phases. One of the most common ones is patients asking the same question over and over again. Some patients are very surprised that the surgery has completed. You will be reoriented to time, place, and location. In general, you're in the PACU area for a minimum of 30 minutes to an hour or more. After PACU, you're often moved to your next phase of care, which is you might be downgraded to being discharged to home. And depending on where you are, if you are in an outpatient area, it might be the same nurse and the same bay that simply end PACU time and start your discharge time. In other hospitals, you may be moved from the PACU to another area where you will now be prepared for your discharge. If you are being admitted to the hospital after your PACU period is over, you are taken to your hospital room. Sometimes, depending on how the patient does in PACU, we may need to transfer the patient to a higher level of care, and this might be transferring them to an ICU or in an intermediate floor. And this may depend on things such as um, their breathing, respiration, circulation status, level of consciousness, and all of those. So prior to discharge from the PACU nurses usually use a discharge criteria. One such one such system is called the Aldrete score. The Aldrete score is scored from 0 to 10, and those 5 items that are looked at are your activity level, respiration, circulation, which is your blood pressure and hemodynamics, your level of consciousness, and your oxygen saturation. If you meet the discharge criteria, then you are discharged. Now we're going to move on to your discharge area. If you're going home, you go to an area where you get prepared for discharge. One of the few things that they look for during the discharge are your discharge instructions. You or your caregiver will be given paperwork with your discharge instructions, and those would include wound care, dressings, follow-up surgical appointment, what to look for, when to call your doctor, and if you need to come back to the emergency room. When you get discharged from a hospital to home, it's important that you follow up on your follow-up surgical appointment because that is when your surgeon gets to look at your incisions and address anything that might happen in between. So some of the things that might happen, sometimes surgeons might not be attuned to is if their wound is developing an infection, if there's redness, um, that needs to be seen by your surgeon. If there are staples that need to be removed, you need to come back to your post-operative surgical visit. The visit might be short, but it is very important part of concluding your surgical procedure. Okay. Now, when you do go home, it's important that you rest, you take plenty of fluids, and if able to, always encourage the patients get up out of bed, sit in a chair, or that they walk if they're ambulatory in their house, for instance, walk to the bathroom, um, walk from one room to the next, and that they take deep breaths, expanding your lungs. Because if you had general anesthesia, if you're intubated, you would have had some areas of lung collapse called atelectasis. If you do have pain medications, do take them when you have pain, and it's best to be ahead of the pain. The immediate 8, 12 hours after surgery is when you would usually have the most amount of pain. For patients who have comorbidities, I recommend that they have a family member stay with them at home to just be a second amount of eyes over the patient, um, in case anything happens. This is especially if the patient has decreased level of consciousness, has altered mental status, such as an elderly with Alzheimer's, or if they're a child. We want there to be a responsible, capable adult who can monitor the situation and call for help or bring you back to an emergency room or to a surgery if needed. One thing to keep in mind is that depending on where your surgery is, that entire process of going through pre-op, operating room, PACU, and discharge might be quite a long time. If you're in an outpatient surgery area, they're usually very efficient about moving you through all these phases and getting you discharged. But if you are in a hospital, just give or take a good 6 hours of being in that facility. If you find any benefit, share, comment, like, and follow.